This video is all about drugs for angina. What is angina? It's marked by a very severe chest and back pain, or a tightness in or a pain in the chest. And the reason it happens is to do with the fact that the blood has its own blood supply, just like any other tissue in the body, and as such it needs oxygen and nutrition just like any other tissue. So when blood leaves the aorta, of course most of it goes to the rest of the body, but a small proportion enters the left and right coronary arteries, and these then supply the heart muscle with the required oxygen and of course nutrients, but oxygen is the main thing that's a problem in the short term. So angina happens when the blood supply to the heart is not enough for the heart's oxygen requirements. In other words, oxygen supply becomes less than the oxygen demand. And this isn't anything unusual. Any muscle will, if you contract any muscle in the absence or when there's not enough oxygen, that will result in pain. And that's the same during exercise. That's what causes the pain of exercise. So angina happens then when the blood supply to the heart is not enough for the heart's metabolic needs. There are three types of angina: stable angina, unstable angina, and variant angina. Stable angina is when you get pain predictably occurring during exercise or exertion. So this happens when normally if you're at rest there is no pain, but then when you start to run up the stairs or to run for a bus, you start to get pain in the chest. That's stable angina. Unstable angina is when pain occurs during less and less exercise or exertion. So whereas before running up the stairs would cause pain, now you're finding that simply walking up the stairs or walking on a level surface starts to bring about pain. And eventually the pain actually happens even when you're at rest. So this is unstable angina. These are the two most common ones, and of course they're just two things on a spectrum. There is another one called variant angina, which is quite rare, and you get this when you get pain at rest, but it's caused by a spasm of the coronary artery. So in other words, this artery here contracts spuriously, so it starts going into spasms, and that causes obviously a lack of blood supply to the heart. So how are these things prevented and treated? Stable angina is prevented by statins, which reduce atherosclerosis and help to preserve the quality of the blood supply to the heart, and aspirin, which prevents small blood clots. It's treated by a combination of nitrates, beta antagonists, and calcium blockers, or by simply, well, sorry, not or, but what all these are doing is actually reducing the amount of work that the heart is actually doing. So nitrates widen the arteries, so do beta antagonists, and so do calcium blockers. Unstable angina is also prevented by statins and aspirin, but in addition is also prevented by clopidogrel, which is an ATP receptor antagonist. The treatment for unstable angina is the same as stable angina. Variant angina is treated, again, the same way. So you basically got these three ways of treating reducing work: nitrates, beta antagonists, or calcium blockers.